Okay, so what does pharmacology mean? Well, pharmacology, the word, comes from the Greek prefix pharmako, meaning drug or medicine, and the Greek suffix ology, meaning study. So pharmacology is the study of drugs or medicine. And a drug is defined as a therapeutic agent. It is any substance other than food used in the prevention, diagnosis, alleviation, treatment, or cure of disease. A chemical substance that affects a biologic system. Legal and illegal, such as street drugs, prescription and non-prescription, such as over-the-counter, and herbal and non-herbal supplements. Pharmacokinetics is what our body does with the drug. So if it helps you remember, your kin is absorption, distribution, metabolism, and excretion of a drug. So pharmacokinetics, it's what your kin does. So if I'm your kin, you should add me. Absorption, distribution, metabolism, and excretion. Kin, add me. Pharmacodynamics is what the drug does to our bodies. It's the biochemical and physical effects of drugs and the mechanisms of drug actions. So pharmacodynamics has a D, think drug, what the drug does to our body. Pharmacotherapeutics is the use of drugs to prevent and treat diseases. Where do we get drugs? Well, traditionally, drugs were derived from natural sources, plants, animals, minerals, used as they occur, minerals I'm referring to now, used as they occur or combined with other ingredients, iron, iodine, Epsom salts. Today, many are synthetic drugs. We make them. They're free from impurities, and you can manipulate the chemical structure to be more effective. Why does this matter to you? Well, as I told you when we were discussing medical emergencies, the most important way that you can avoid a medical emergency is to obtain a good health history. And you need to know that some people will be taking medications for many, sometimes multiple systemic diseases. And the only way to find that out is to get a good medical history. If they list a drug but don't mark the condition, ask specifically if they are taking a drug. If they list a condition and don't have a drug listed, you may have to ask specifically. And the other thing you want to know is why are they taking that drug specifically? Okay, and why do you need to know this? Because you will be administering drugs in office. Fluoride, nitrous oxide, and local anesthetics. And you need to understand how they work and what they can affect. You also need to know how to handle an emergency. Syncope, which is fainting, angina, chest pain, hypoglycemia, low blood sugar, etc. This will also help you plan appointments so that you can schedule times for patients who are diabetic so that they can come in after they've had breakfast and after they've had their medication. It will help you choose medications for yourself and help you understand OTC medications, herbs, and supplements that patients are using. So when discussing drugs, you need to understand the terminology. And this is part of our lifelong learning because new drugs come out every day. So it's hard to keep up with them all. So you need a good drug reference. And I'm just going to leave that up for a minute. How do we name drugs? Well, nomenclature is the naming of something. Drugs can be divided into a chemical name, which describes the chemical structure, generic name, which is the official name of the drug, and that could be ibuprofen, and it's one name per drug, small case letters. Trade name, which is also called the proprietary name. It's the property of the registering company. For example, is Advil, Motrin, Bayer aspirin. The first letter is capitalized, and this has some financial implications because the patent is good for 17 years. Drugs are also related by two different classes. Pharmacologic class, that's drugs that share similar characteristics or act in the same way. An example is beta-adrenergic blockers. Or therapeutic class, drugs used by or grouped by therapeutic use, such as antihypertensives. Some drugs are over-the-counter. This means that they can be safely and effectively purchased without professional guidance. Prescription or legend drugs are medication requiring a prescription to be dispensed by a pharmacist. And this is FDA regulated. Controlled substances, which we have heard a lot about lately, have a much higher abuse potential. These are regulated by the DEA. Moving on, these are federal regulatory agents that monitor drug activity. The FDA monitors drugs to make sure they're safe and effective before they're even released. It also regulates prescription as well as over-the-counter. The Federal Trade Commission prohibits false advertising of cosmetics, food, and over-the-counter drugs. For example, Listerine has claims about biofilm, and the FTC determines whether Listerine really can help with biofilm. The DEA, and I want to enforce this, or not so much enforce, but emphasize this, it regulates the manufacture and distributions of drugs that have potential for abuse. That's a test question. And a lot of people misread it and say it's FDA. It's not. For drugs that have a potential for abuse, it's the DEA. Some drugs have, in addition in their labeling, a black box warning. This is required by the FDA if medical studies have shown the drug may have potential to have significant risk or life-threatening adverse reactions. For example, in January of 2011, the FDA required a black box as a warning label on all prescriptions containing acetaminophen, that they could be taken no more than 325 milligrams. And the reason for this is that you can overdose on acetaminophen. In 2004, certain SSRIs, which are selective serotonin reuptake inhibitors used for anxiety or antidepressant, in children and young adolescents may lead to suicidal thoughts and actions. And this is what it'll look like. You see the box with the warnings in big letters, and it talks about the drug, gives you the information. There have been some legal things put into place for the control of drugs. We had the Harrison Narcotic Act. It controls use of opium, opiates, and cocaine. Believe it or not, prior to 1940, opiates were sold over the counter. They added marijuana in 1937. The Controlled Substances Act, also known as the Comprehensive Drug Abuse Prevention and Control Act, replaces the H&A to reduce abuse and dependence. So this oversees the Harrison Narcotic Act. It identifies drugs with high potential for abuse, and it established 5 schedules and treatment requirements for each. So drugs are scheduled. You notice that there's 2 through 5 listed here. That is because Schedule 1 are not appropriate for any medical use. Schedule 2 through 4 require a prescription. Schedule 2 must be written in ink or typed or computer generalized and signed by the prescriber. You cannot call in this drug over the telephone. There are no refills. You have to have a new prescription. And Schedule 3, 4, and 5, and this is also a test question, can be called in and refilled no more than 5 to 6 times in 6 months. And here's another slide showing the same thing. As I said with Schedule 1, there's no currently accepted medical use in the U.S., so you won't see this on your patient's health history. 2 is the highest, or is the high potential for abuse. 3 is a little bit less, and then 4 is lower potential. And then 5 has relatively low potential for abuse as well. I do want to mention in your book, it still lists hydrocodone under Schedule 3. It was moved up to Schedule 2 about 2 years ago, so keep that in mind. How are we going to learn about drugs? Well, there's all kinds of sources out there. There's the USP, the PDR, Mosby's drug reference. We use Lexicomp in the clinic. The previous instructor preferred this book, Lexicomp. I personally prefer Facts and Comparisons, which is a more expensive program, but it's much more comprehensive and it's on the computer. So you can actually type in all the patient's medications and what you would like to prescribe, and it will pop up all the adverse effects and how severe they are. And there's a drug card reference, has the name, generic and trade, indication, side effects relevant to dental hygiene care, xerostomia, blood pressure changes, increased bleeding risk, nausea and vomiting, and respiratory effects, and CNS effects. This is the information you need to know. So you need a reference that gives you all of these things. And as most of you know by now, you can look up almost anything on your phone. If you check a reliable source, it can give you these pertinent information. Your role as a dental hygienist is to understand that many drugs may have a dental effect. Many drugs lead to xerostomia. You need to know the generic and brand name of common drugs so that you can recognize them. Why is a drug being taken specifically? Of course, you always want to do a thorough exam, patients with dry mouth and other patients as well, and be ready and able to educate the patient about treatment to help with these xerostomach conditions. Stress compliance when doctors have dispensed any antibiotic. Many times patients will get a prescription antibiotic, take it for a few days, and then stop and don't take the complete dose. And then they have an infection that comes back and it's worse than it was before. So if your dentist prescribes an antibiotic, stress to the patient to finish the whole bottle. Now we're going to talk about prescription writing. You won't be doing this, but the dentist may ask you to print up a prescription on the computer, as most are now generated that way. Nowadays, we use metric units. There was an older apothecary system. It's very cumbersome, hardly anyone uses it, and there's Abu Dhabi system where in Old English weight systems were used. We don't use those anymore. So everything will be metric. This is another slide that you need to learn. AC, if you can think, like antebellum is before war. So ante-C is before meals. These are Latin. PO is by mouth. HS is at bedtime. Q means every. For example, one tablet. Q6H would be one tablet every 6 hours. UD is as directed. You really need to be more specific though. H stands for hour. SIG means right, or the directions for taking the prescription. PC or post-C means after the meal. BID, like bicycle, is twice a day. TID, like tricycle, is 3 times a day. And QID, like quadricephalic, is 4 times a day. Stat, as you have heard on some different TV programs, means right now, immediately. PRN is as needed. This is used with pain drugs. Take it when you have pain. D is daily. TAB is caplet. And CAP is capsule. Okay, and so these are some common equivalents from the old system to the metric system. But generally, if you have to dispense some cough syrup to your child or for yourself, if you don't have a 5 millimeter or a millimeter measuring cup, you can generally know that 1 teaspoon is 5 milliliters, 1 tablespoon is 15 milliliters, 1 ounce is 30, and so on. Prescriptions are broken up into 3 parts. The first part is the heading. This is the name and address of the prescriber, and these are sometimes on pre-printed pads, but now most are computer generated. The name, address, and date of birth of the patient, not so much the age anymore, date of birth. The date dispensed, the date you are writing them. Rx means Latin for take thou, and that will be the drug you're prescribing and its dosage. The amount to dispense, and that is going to be how many capsules. For example, 40, and you want to write out 40, not just put the number. Patient directions, and the closing is going to be the prescriber's signature and DEA number, and whether or not there are any refills. Okay, so there's some rules for prescription writing. They must be written in ink or typewritten or computer generated. Full name and address of the patient. Full name, address, and DEA number of a practitioner, dated and hand-signed by the practitioner. This is not something you can do for your doctor. They have to do it. Here's an example. Notice at the upper left, the dentist's name, address, and phone number. This is handy for the pharmacists if they have to call and ask about a specific medication. Name of the patient, the date it is being dispensed, the patient's address, and date of birth. In the Rx part, the drug that is being used, and it should have a dosage or a strength behind it, like 250 milligrams. How many to dispense? 15. And then 1 tablet every 6 hours is needed for pain. And then at the end, you'll have the number of refills, the signature, and the DEA number. Okay, in children, it's not good to just blanketly give them dosage recommended. We have to calculate it from weight. And so we have to figure out how much to give the patient depending on how much they weigh. There are some different pregnancy categories of drugs: A, B, C, D, and X. A is the safest category, and B and C are a little more iffy. D has shown that it can harm the fetus, and one of the drugs is tetracycline. Tetracycline causes gray teeth. And X means you don't give it to women who are pregnant or may be pregnant. An example of this is estrogens. There is a new system that's out now. You'll find a copy of it in your content materials. I don't know how frequently it's being used. I just discovered it myself this year. Okay, that's it. click out here?
Yeah.